tusonge mbele. Na kama umekaa na mtu hamjui, please say hi. Hata kama unamjua, say hi. Mwambie ask your gyno. Leo ndio ile siku. Tusonge mbele. Talk and walk, walk and talk, sawa sawa. Walk and talk, tusonge mbele. Mbele yako kuna kiti, tusonge mbele. For those who don't know me, my name is Eunice Anzazi Rimba. Na mimi ni mtoto wa hapa Cathedral. Lena. Let's settle down. Watu wangapi wanatoka Cathedral? Wangapi hawatoki Cathedral? Do you mind telling us who you are? Since wewe ni mgeni. Sawa sawa. Just tell us who you are and we welcome you to Cathedral. Sawa sawa.
Good afternoon. My name is Cindy. I got an invitation through a WhatsApp group I joined recently, the Bold Up. So I found it wise to just come and listen.
Thank you, Cindy, for coming. Nani mwingine hatoki Cathedral? Tusalimie. So turn to your neighbor and tell her, ask your gyno. Ask your gyno. So there's someone who is going to help us ask our gyno. So I'd like to welcome Faith and her team to help us ask our gyno. Karibu, Faith.
How are you? Hi. Are you ready to ask your gyno? Hata pia mimi ni Dr. Faith. Na mnani doubt, nitatoa credentials. So asanteni sana kwa kufika hapa because it's an opportunity that most of us don't get. We hardly visit our gyno, but leo our gynos are here and we are going to ask them every single question. Usishikilie because today they are here. Tena wajalipa, amulipi consultation. Imagine. Hakuna consultation leo. Kwa hivyo uliza, exhaust yote. Okay, akikwambia tuonane kule kwingine, utakuwa unajua. Ama namna gani? I am Faith Ngami and I am pleased to be here today and I'll also welcome our doctors. Karibuni sana. And thank you so much for creating time. They've created that time. Vile pia you guys have created your time to be here today. So they will introduce themselves. Alafu tutaendelea. Ama namna gani?
I thought we had agreed Dr. Karanja is going first, but it's okay. I think she decided to go with ladies first. So my name is Dr. Mitei Chepogen. For purposes of not biting your tongue as you enjoy your uji power, just call me Mitei. See, that's easier. Mitei, okay? I am a gynecologist and an obstetrician. Today, we are going to be talking about lots of gyne issues. When we say gyne, it means anything that does not involve being pregnant. So anything else apart from being pregnant. However, I'm not stopping you guys from asking obstetric questions. Sawa. I'm very passionate about women's health, specifically the adolescent group, but I still voice out for every other woman. It's just that when I'm with the adolescent group, my heart beats a bit faster. You remember that first feeling when you saw someone that you liked? So I get that feeling when I meet adolescents a lot. Sawa. I work with Dr. Karanja at Modern Gyno, but we also both work for Kilifi County. Sawa. But you can find us easily where? Yes, at Modern Gyno. Asanteni sana, tunashukuru mumetukaribisha. We cannot wait to talk to you and answer your questions. And of course, enjoy the uji power. I'll be going for the third cup. No judging. Tulisema? No judging. Go on.
Good afternoon. It's okay? So Karanja is my name, and I'm an obstetrician, gynecologist. I hope she's defined who a gynecologist is and who an obstetrician is. You've understood that? So who is an obstetrician? Maybe we start there. Who is a gynecologist? It's a free. We are yes, yes. Who is a gynecologist?
I'm giving a hint.
Obs. You can give her the mic.
Anything related to pregnancy.
Yes.
Sawa. So when you're walking the journey of pregnancy, you're talking to with the obstetricians. When you're walking the journey of anything else apart from pregnancy, it's gynecology. And by the way, sisi si madaktari wa wanawake, ni madaktari wa uzazi. So when Talaki said that the men should leave, I was about to tell him, no, let the men stay. They have sisters. We also talk to men about reproductive issues.
Thank you for that clarification. Maybe kuchangamsha your minds. Who can guess who was the first gynecologist?
In the world or in Kenya?
In the world. Someone has an idea? Helen? Yes. Helen has pointed you. Just make a guess. God in the world, not in heaven.
God.
Yes, there's a hand over. Hey.
Tuambie tu.
Adam gave the gynecologist the first business. Yes. But he was not the gynecologist. You remember the woman who had the problem with bleeding? Where did they get the healing? From Jesus. So Jesus is the first gynecologist. It's as simple as that. I had a gift, but now Anyway, we are happy to be here. We will be free. Hakuna kushikilia swali. Ask anything using any language. Sindio? See, we don't have our parents here. Jacob ako wapi? Jacob might be the eldest. Ask anything without fear, and we will answer. When you go see a guy, most of the time you reveal everything. So it's not a must that when you ask a question, people will assume you have that problem. You could be asking for a friend, you could be asking for a mother, maybe you read something on the internet. So be free. It is not our words to you. It's like an exchange program, okay? Sawa sawa. Asanteni na karibuni sana. Thank you, Faith, for having us.
Karibuni tena sana. And to begin with, we have different topics for the day. And we are mostly going to tackle menses and abnormal discharge. We will tackle menses and abnormal discharge. So you can ask, so Daktaris will first describe menses, everything. Then later on, we are going to have the Q&A, where you're going to ask any question in regards to the topic that the daktari watakuwa wameongelea. Then after that, we will have another Q&A from the social media, because we have people who've also asked questions from the social media. And then we are now going to have an open forum of a Q&A. Now ask any other thing outside the topic that daktari watakuwa wameongelea. Tumeelewana? So they will discuss the menses and discharge. Then we will have Q&A in-house. Then we will have social media Q&A. Then now you will have a general Q&A where you're going to ask now any other thing. Okay? And how we'll check the questions, we will be doing maybe 3 people ask, then they answer, another 3 ask, then answer. Sawa sawa? Aya, so to begin with, nitakaribisha Dr. Karanja, and he'll start us on menses. Karibu daktari.
Thank you. I think I've already started. You remember this? Anyone who doesn't remember? Turudishe school fees, eh? So, we all know the uterus. the ovary, the fallopian tube, and we have the brain. Okay? Let me ask a very simple question. It sounds very simple, what we were taught in biology. And if you get it wrong, you ask for your school fees. Eh? Where do the periods come from? The menses, the blood. Where does it come from? If you can have a mic. Itafika. Ama atumie hii.
Shedding off of the uterine wall.
Any other guess?
Shedding off of the uterine wall.
Shedding of the uterine wall. Nice try. Any other guess? There's no wrong answer, by the way. Because even me, until I went to medical school, whatever I was taught was not the right thing. Yes?
If I remember clearly, when an unfertilized egg is dislodged from the ovaries,
Yes.
it goes and attaches itself to the uterine wall, and then there's shedding because it's not been fertilized by the time it gets to.
So it comes
Yes,
here.
yeah, correct. And then if it does not get fertilized, then it causes shedding of the uterine wall.
Of the uterine wall. Almost what we were taught. Eh? Who has an answer of what we were taught? What we were taught in biology. Okay, the way I understood it, and I'd like to make that clarification, because I see many women, and they do confuse how periods happen, ovulation. So mimi nilifunzwa, hii mayai, after ovulation, this egg is the one that comes and is the one that bleeds. Sindio? Yes. But it's what you said, partly what she said and partly what you said. This egg doesn't have to come down. Actually, most of the time, it drops into the pelvis inside. Okay? Let me start here from the brain. So we all have the brain, eh? We all have brains, eh? So the brain produces hormones. That's where the menstrual cycle starts. The brain produces hormones. Those hormones, which part of this is called what? Sorry? The ovary, yeah? We all have ovaries. Except Boniface. So there are hormones which come to the ovary. They stimulate the ovary to produce hormones. So those hormones we have another set of hormones from the ovary. Now, when you have ovulation, behind there, when you have ovulation, part of this egg also produces hormones. But it's not this egg that comes to stimulate that uterine wall to shed. It is these hormones which are produced into the bloodstream. So it goes into the bloodstream. Then we have blood vessels that come to the uterine wall. What she said, what she meant is here. You see this part of the uterus? You can all see? That part of the uterus is stimulated to prepare for a pregnancy. So when you ovulate, your ovaries produce hormones. Those hormones, they make this wall thick in preparation for a pregnancy. So according to God, We should be pregnant every month. All of us, except Jemo. That is science, because every month you ovulate, your uterus prepares for the baby. Then if you don't get pregnant, the hormones again make this uterus shed off. So this is what comes out. This thick wall comes out as blood. Then you have another thin layer starting after your periods. Then when you ovulate, it starts to thicken again in preparation for another baby. So you can imagine how many you're wasting. Okay, the reason for understanding this is so that you understand the menstrual cycle. And the menstrual cycle is how many days, the normal? 20? 28 this side, this side? Sorry? 21? 28? 28, 27, 34? 32? So if we say 28-day cycle is the normal, so it means 70% of you have abnormal cycles. That's what you mean. Sindio? Because I'm very sure, ni vile siwezi uliza, but I'm very sure many of you here, it's not 28-day cycle. Sindio? It's 21 to, someone said it, 35. 21 to 35. So you'll find a lady will come and tell you, I get periods twice a month. Tarehe moja na tarehe 25. So to them, they know that period inafaa kuwa monthly. January, February. Then December anapata 2. Anaona kuna shi? So if your cycle is 21 days, it means in January, if you get your period on 2nd, you will receive it again on 23rd. So you'll have 2 cycles in 1 month. And I hope you know what a cycle means. A cycle starts from where to where? Sorry? The first day you see your menses, you receive your menses, to the day before the next fast. So, sio unaanza the day imeisha. Some people count from the day imeisha to the date. And you can know your cycle by just downloading an app on Play Store. You should all, by the end of this discussion, you should all download. Thank you. I can see some are showing what they have downloaded, so that you monitor your cycle. It will help you a lot. Even when it comes ile time ya trying to conceive. Your partner works in Nairobi and you're in Mombasa. Then you go to the guy and unasema, it's a whole year I have not conceived. Kumbe huwa unaenda ile time ya kubahatisha. But if you know your cycle well, you will know the right time to travel and when to conceive. And that app will even tell you when is your likely day to ovulate and how you feel. You might be thinking you're just moody because of work, but it could be because of the cycle. Maybe that's when you're ovulating, maybe that's your period almost. So this is the 21 to 35 days. If it's less than 21 days or more than 35, your cycle is not normal. Okay? Now, just a caveat. If your cycle is 28 days, it should not, the difference from this cycle and the next cycle should not be more than 7 days. So kuna cycle utapata 28 days, kuna cycle utapata 30 days, kuna cycle utapata 26 days. That is not an abnormal cycle. Watu husema hiyo ni irregular. Ati daktari nilipata tarehe 1, next month nikapata tarehe 3, hiyo month nyingine nikapata tarehe 2. Your cycle iko sawa. Si lazima iwe tarehe 1, tarehe 1, tarehe 1. We are clear on that? So you can, if you have 28 days, it can go to 25 days. The next cycle, it can be 29 days, so long as it doesn't go beyond 7 days. That is the cycle. Now the flow. How many days is normal? The flow? This side? 5 days. You can give a range. You can give a range from this to this. 3 to 7, 3 to 7. 3 to 5. Pale nyuma. Half a day. So what were 2 days? It's abnormal. So it's 2 to 7. Yes, 2. Inaweza kuja leo, kesho. Wa. Utashukuru So it's 2 to 7 days. Sawa sawa. Then you expect the first 2 days to be the heaviest flow. Then after that, inaenda ikireduce. Okay? Cramps that bother you are not normal. Yes. When? What do I mean by? More than? Oh, bother. Okay. So unajua vile watu tunaambiwa, periods hizo zitaisha ukishapata mtoto. See, that's what all of you are told. Even your mother will tell you. Even me, I used to have that problem when I gave birth. Your cramp should be normal cramp that you can go about your daily activities. If you have a problem with your home chores, your workplace, you have pain, you have to take a rest, you have to take paracetamol, you have to take Buscopan, don't assume. It could be normal or it could be abnormal. So you have to go see a gynecologist. She's here. Sawa sawa. But you can also visit me. Sawa sawa. I hope I've cleared that. What I mean is, we don't have a test to measure your pain. There's no painometer. Your pain is not her pain. Everyone has their. It's like those kids who you pinch them and they just look at you. Alafu kuna mwingine utamuguza hivi, ataruka kabisa. If you think you have pain, go see your gynecologist for that. Okay? I think I've covered well. Let me not take a lot of time. This topic excites me. Sorry?
You still have time.
Oh, I still have time. Okay. Now, about the flow. What is heavy flow? And what is normal flow? There's a way we measure, but again, another problem is we cannot give you a container. Because we say 80 mLs. But if you keep on changing your pads like every 2 to 4 hours and it's fully soaked, there's a problem. But if it's only that one day, that could be normal, the second or the first day. But if your flow is 5 days and you have to change pads like every now and then for the 5 days, that is not normal. If you've been using 3 pads in a day, then you start using 6, 7 pads in a day, that is not normal. So normal for Karanja is not normal for Agatha. Okay? So not unless now you have that app and you walk that journey with your gynecologist who will now advise you if this is normal and this is abnormal. Sawa sawa. But when you talk to the, sorry? Yes.
Some of us use tampons.
Yes. Explain.
We don't all use pads. Sometimes we use tampons, right?
Yes. I explain the tampon part.
So basically, if you have to change your tampon every more than 3 hours, like so that's like what? You're using more than 3 tampons in a day, except the one you normally change to go sleep. You know, all of us will change before we go sleep. If you're using more than those and it's fully soaked, you could be changing because you're feeling like you're dirty. You know, there's that feeling you have. You just feel like changing because you're dirty. But it has to be fully soaked. And sometimes you're even forced to put a panty liner or a pad apart from the tampon. Then that's heavy.
Tumeelewa hiyo? Then pads, change your pads every 4 hours. Nyote mmeniangalia zile za tutanunua mingi. Maximum. Sorry? Yes. Yes. You know why? You see blood? It's like when you put water in a cup. You put water in a, and you come and drink that water after 4 hours or 6 hours. Are you going to trust that water? Yes. Now imagine blood. Blood is a good, what we call a good culture media for bacteria. So when there's a lot of blood there, bacteria grows in that blood and you will get recurrent infections. Sawa sawa? Yes. So 4 hours, ukienda sana, maybe uko kazi, ukienda sana 6 hours. There are those pads they advertise you can use for 8 hours. That is marketing. 4 hours maximum, 6 hours. You can quote me, eh? Sawa, asante Faith.
Asante sana daktari for shedding light on that, on the menses. I know mko na maswali, but kutafika hiyo time ya maswali where you will ask the questions in regards to menses, in regards to the cramps, okay? So right now we will welcome Dr. Mitei. She will take us through discharge so that we are able to understand what is normal discharge, what is abnormal discharge. Again, mutauliza maswali after that. Sawa sawa.
Let me clarify something before I erase this. Something I forgot. Now, you see where the brain comes in? When you're stressed, when you're sick, when you travel, climate change, when your boyfriend is behaving like a baby. It affects your brain and your hormones and your ovary and your uterus and your cycle misbehaves. You either bleed mapema, ama inachelewa, ama you bleed a lot. So you'll go to the hospital, they do a scan, it's normal. Hormones, it's normal. Unaambiwa umero?
Thank you so much. Hamujarogwa, stress ya anything can basically disrupt that cycle, okay? I'm just picking up from where he left. So the hormone is called cortisol, but you can just call it the stress hormone. That affects that cycle. So I do want him to erase that because I'm not a very good artist, but I might be needing that diagram at some point as well. Sawa sawa. So is bleeding abnormal or not normal? Or normal, sorry. I love that question. You're the smartest. I love that you asked which bleeding. That tells me that you know there is abnormal bleeding and there is normal bleeding, which is your menses. Yes, perfect. You taught well, Dr. Karanja. Just from that, you taught well. So now I'm going to talk to you again using the same diagram. Your discharge will depend on your hormone, your cycle, just the same way Dr. Karanja has explained. So when you're having your periods flowing through here, okay, you'll have the normal menses, which is different from everyone. Some other people can have it 2 days, some people can have it up to 7 days, okay? So that's normal. When you finish your menses, what normally happens? We said tutalisten, hatutajudge. What normally happens? Do you dry out or you have something? Sometimes you have something. What's the color of that something? Clear. No one has brownish reddish? Yes. So sometimes you can have brownish reddish, even sometimes black. Okay? Yes. People describe it as black. It looks like, let me call it liver. You've ever seen liver saa zile ishatoka inakuwa nyeusi, not black like the mic, sorry. I meant like dark. I should have said dark. Sorry. So when it's dark towards the end of your cycle, that's okay, because what happens is the little blood that remains after your menses gets oxidized. Means inaweza pata oxygen kidogo, ina change color, inakuwa bit blackish. But what to look out for? Smell. If it smells, it's not okay at all. Sawa. But generally, after your menses, you should have a dry face. It can be a day or two. So you have a bit of dryness, and then now it goes to clear, which she clearly said. So it becomes clear, cloudy, or white. Okay? Clear, cloudy, or white. So when you move from clear, cloudy, and white, it's those days we call safe. It's cloudy and clear, okay? It's those days we call what? Safe. But it's not the same for everyone. It means you have to learn to always check the consistency of your discharge. I don't want anybody getting pregnant and saying, Mitei said, when the discharge is clear or cloudy, I am safe. So it's something that you need to study as an individual. You'll be able to tell there are days when my discharge is like this, there are days when my discharge is like this, and I think I shouldn't be getting pregnant, so maybe I should play safe. So when we move from the clear cloudy, now we go to clear watery. Clear cloudy is almost off-white, white, but watery is clear and very watery. Enye ukifanya hivi haistick. Sindio, water huwa ina stick mkifanya hivi. Except ya Mombasa, enye na sawa. But so it becomes clear and not, the reason is that sperm needs to swim. When it's sticky, will it swim? So that's the day you're not safe. Okay, so it becomes clear. Then after, that's the time we say during ovulation. It's hard to tell from your cycle exactly when you ovulate, except if you've studied your cycle very, very well, which means you know precisely my cycle is 35 days, or it's 28, or it's 21. And something that maybe Karanja mentioned and I might have maybe slipped out is ovulation is different for everyone. It's not the 14th day because you're on 21, 35. It's the 14th day from the day you're expecting to get your menses. Not from the day you started your menses. Are you understanding me? So 35 minus 14 is what? Oh, you want me to rewind? Okay. So now I meant everybody has a different cycle. So we don't all ovulate on the 14th day, which is what is out there. Everybody assumes they are all ovulating on the 14th day. If my cycle is 35 days, I'm not going to be ovulating on the 14th day because I'll ovulate 14 days before I get my menses. Are we there? Are we there now? So if my cycle is 35 days, 35 minus 14 is what? 21. So I'm ovulating on my 21st day. If her cycle is 28, 14 minus 28, it's easier for the 28 guys to actually know. If your cycle is 21, around 9, 21, 7. So you see, we are all going to be ovulating on different days. Now, just because I gave 21, 35, and 28 as examples, does not mean those are the only circles. There are people who have 29, Mungine 26. So everyone has a different circle. So when we move, after you've ovulated, you're about to again start bleeding unless the baby was formed, okay? So now, I started with saying yellowish creamy white can be normal, except if you're having other things that go with it. So you're having pain in the lower abdomen, you're having, it's smelling bad, or whenever you meet your partner, you're starting to feel pain, okay? that you need to see Dr. Karanja or I so that we expound further and see if there's something we need to treat or tell you that you need to change. Sometimes it's just hygiene. Sometimes it's just hygiene. We don't always prescribe. And you guys are making it difficult for us nowadays because when you come to us, you want to live with a medication. Please listen to us when you tell you, you just need to drink water, take yogurt, cranberry juice, wear cotton panties, don't do. Understand us when we say that, okay? We are looking out for you. We wouldn't be sending you away with that and no medication if we were looking out for you. Sawa sawa. Okay, so now let's move from yellow. Let's go to a discharge that looks pinkish. It looks pink, 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 pink. So pink or reddish, and you're not expecting your menses, is an alarm. Okay? An alarm because two things could be happening. Maybe you've gotten pregnant and the baby is simply just trying to dig into your uterus to find a house to live in. The same way you move into a house and you put a bed, okay? If you come and we find out that's the case, we just assure you, probably give you a few painkillers and teach you what we call danger signs, okay? But sometimes it could also be a sign of what? Ectopic pregnancy, okay? If it's off the time that you're expecting your periods. So again, that's why I asked you guys, is bleeding normal or abnormal? And I liked that you answered me, which bleeding, okay? So sometimes bleeding can be abnormal as a sign of things that are happening, example being ectopic pregnancy, okay? Now, if we have greenish discharge or deep yellow, fall smelling, is that normal? That's not normal. Completely. There is no way I'll ever tell you greenish is normal. It's not normal, okay? Greenish, yellowish, deep yellow, fall smelling, you're having pain, okay? Whenever you meet your partner, there is pain. Or even if you don't meet your partner, but still you are in pain. Please see a gynecologist because it could be many things. I will list a few. One of them is bacterial vaginosis, okay? That has a very offensive smell. It has, am I wrong, Dr. Karanja? It will have a very offensive smell. You won't need somebody to tell you that that discharge is smelling. You'll actually tell. And sometimes you feel very self-conscious because you can smell it. You think all other people around you can smell it, okay? So other things could be when you have yellow, inakaa kama maziwa ya mgando, like mala. Sometimes it's cutting, kwa panty unaona katika. You're itching, okay? That's candidiasis or yeast infection. Ama fungus ya Miss V. Sawa, you can have fungus of the skin, the nails, so that is fungus for Miss V. Not sexually transmitted. You know why I'm saying not sexually transmitted? We live in Mombasa, and we women who live in Mombasa have a higher tendency of getting yeast infection. And then we start blaming kina Karanja, oh, sijui ulikuwa na nani. So sometimes it's not an STI, okay? Are we okay there? Sometimes it's the temperature that we have as women. We are kind of hot, as in hot and hot. Have you understood? Yes. So we are hot, and then the climate does not do us any justice because it becomes warmer. We have the discharge. That's a very good media for the yeast to grow and thrive. Hence why Dr. Karanja was saying, even if it's dry, please change your pad. Okay? Because that's already a media or a house for the yeast to grow. Yeast inaweza anza affect the normal bacteria that is supposed to protect Miss V from getting infections. So you find a lot of times you're having a yeast infection plus a UTI. Okay? And sometimes when we are treating you for UTI, you finish and you get yeast. That's a side effect, okay? It's a side effect of antibiotics. So whenever you have taken antibiotic for whatsoever reason, and then you start having the katakata discharge, just know it's a side effect. See a gynecologist, get a medication for it. But we've understood it's not a sexually transmitted infection, but it's good if it keeps happening. We call it recurrent. If it keeps happening, please take for your partner some pills as well, or alert the gynecologist that in this period of 3 months, I've gotten this infection twice. Think maximum should be, I'm not saying it's normal to get yeast infection, but 3 to 4 is what we say is okay in a year. Okay? So if you're getting 2 infections up to Tukomei, up to today, that's already a lot. Okay? So it means we need to also treat your partner, but the reason I kept insisting it's not an STI, I want you guys to be able to explain to your partners or your husbands that the doctor gave me this pill, it's not an STI, but he feels we need to also get treated together so that we can get rid of it completely. Sawa sawa? Now, there is a grayish discharge. Looks gray. I almost pointed at your sweater and then I remembered you might take offense. So, okay, so grayish discharge, okay? That's not normal. Sawa sawa. I'm not pointing at anyone's sweater. In fact, I am turning around kabisa ndo nisione hiyo gray, but that's also not normal. Are we okay up to there? So any discharge that you're having itching, is that okay? Any, I said any. Any discharge that is greenish or deep yellow. Kama una produce maziwa mala na we si mkale. Una produce. Is it normal? It's not, okay? If we are having pink, reddish, and it's not our periods, it's not normal. But one thing I must tell you is you might have pain in between your cycles that could indicate for you that you're ovulating. The pain is normally very sharp on the sides, okay? Don't ignore it. It's still good to see a doctor, especially if it's persisting. And again, what Dr. Karanja said, it's stopping you from doing your daily, is it chores or cause? Chores. Si mnajua group of schools? Yes, mshaelewa? Mshaelewa Kenya nataka kusema, si ndio? So yes, if it's causing you that much pain, come see a gynecologist. We'll probably press your tummy and send you for a scan, because sometimes when these things here are trying to release an egg, what did we say this was? So when they're trying to release this egg, they swell, okay? So that they burst and release the egg. I'm using the plainest terms possible, okay? So when it releases that egg, sometimes it stays big and collects a fluid and it can easily, what am I doing? It can easily twist. So if it twists, it will cause you severe pain and probably will require us to go in and untwist, or sometimes, unfortunately, if you've stayed long, we might have to make you lose your ovary. Hence why I'm saying what? If the pain is so bad, please don't say, "Ee pain nasikianga tu kila time." Just come. You'd rather come, we tell you it's nothing, than sit and then you lose our very beautiful ovary. Okay? I know you'll say my time is not out, but I think I have exhausted. My time is out. My God, these guys are unfair. You have questions? I think I will let Faith take the questions, then we can all answer. Sawa sawa. Thank you so much.
Asanteni madaktari. I know maswali yamejaa. Mko na maswali? Msijali, wako hapa watawajibu. Hawaendi kokote. So we can have questions about, like, we can have like 3 guys asking, then daktari can answer, then another 3 of them, so that at least it can give them, because at times maswali zenu zinaweza kuwa it's almost kind of similar. So we can have one at the back. So we have 1, 2, 3. Okay.
Some people may feel shy to ask. You can just pass a paper around.
Yeah, so we can also pass papers for you guys to write. So unaona there's 1, 2, 3 hapo hivyo nyuma. Nani ni wa kwanza? Nitajibu na hizi. Mrs. Notaro.
Inasikika. Mic testing.
Hi, my name is Caroline. My question is, if someone has this month 28 days cycle, next month it's 30, next is 35, then again 28. How would one count their safe days? And is it normal?
Thank you for this opportunity. Esther, once again. So I would like the gynas to just take us through the process of endometriosis formation. Like, just talk about that endometriosis thing and the whatever, what someone is supposed to do, all that. I think you get it. Thank you.
My question is about cramps. For some, cramps not only come as cramps alone, but kuna diarrhea, kuna stomach pains, kuna back pains, kutapika, so yeah. And how bad should those other symptoms be to know that you're not okay?
Okay. You can hear me? So the first one was 28, then 35, then 25. Which is your? Safe days.
Calculate your safe days.
Uh-huh. For that one, you start with prayers first. You know what I mean, eh? Meaning, I'll go back to what she said. Eh? I love drawing. So if you're psycho, let me use the figures you mentioned. 28 days minus 14, then 30. Someone can be calculating this. Then 35 minus 14. This is 14, 16, 21. Mbona mulianguka maths? Now, in this cycle, you ovulated on day 14. When can you get pregnant? If you're ovulating on day 14, when can you get pregnant? Yes? Yes? When can you get pregnant? I don't mean you. I mean, which days? Mitei? 14. So which are your, when should you not have sex? Days? 2 days before. So day 12, day 13, day 14, day 15, and to be very safe, day 7, day 16. Sawa? Sababu kuna majamaa wana swim pole pole. Okay? So we've said we are adults. Sindio? Am I reduce my voice? Okay. So there are some sperms which can be released on day 12 na zibaki alive until day 14. Zimengojea tu mayai. So, and the reason we give you another 2 days, not everyone will have 28, 28, 28, 28. Kuna month utapata 29. So it means you will ovulate here. So we give you an allowance of another 2 days. Aya, twende hapa. So day 16. So unsafe days, 14, 15, 16, 17, 18. Here? 19, 20, 21, 22, 23. Which are your unsafe days?
All of them, from 12 to 23.
Because you cannot predict the next cycle. That's why I said you start with. It means from day 12, let's listen, from day 12 until day 23. Because you don't know the next cycle itakuwaje. You don't know the next cycle. So the safe and the unsafe days ideally is for someone who has a regular cycle. Yes. That's why you see many, okay, let me not go into religion. But follow, if you see the family planning, contraception, if it was possible, no one should use any contraception apart from the natural method. This is the natural way. You know your days, you can calculate. So, ile time unsafe days, you sleep in the bedroom and the guy sleeps in the sitting room. But how many days are this? Kuna siku utaamka upate ameishia. So it has to be a regular cycle. And if it's irregular, maybe 27, saa zingine 30, saa zingine 29, saa zingine 28. That's why you have contraception. That's where contraception comes in. To take care of those who cannot predict. Sawa? Yes. But remember to say a prayer. The other question was? Now, endometriosis, let me tackle that one last. The other one was on cramps. Yes, if you have vomiting, you have diarrhea, you have severe breast pain, you don't want to eat, it's not normal. You don't want to see someone who is... If those symptoms are there, if you're vomiting, you have loose motion, you will not work. Go see a doctor. We will help you. We will try and regulate what we call, that's what people call hormonal imbalance. There's a lot that happens there. Sawa. Before I handle the endometriosis, let me mention something about the, you said Miss V. You know Mrs. V? The vagina? I forgot to draw it here. It comes down like that. How do you clean your vagina? With water? Mwachane na strepsils, Mwachane na strepsils na tropical. This is now serious stuff. How do you clean your vagina? And what I mean by vagina is, hold for me this. Hold for me. Now, this is the, you know the vulva? Or the vulva? Depending where you went to school. So these are the lips. Pale chini. These are... So this is not your vagina. This is the vulva. Okay? The vagina is inside. So how do you clean the inside? With water, with juice, tropical. Who has an idea? Is the vagina dirty? The vagina cleans itself. Cleans itself. So unazoona unatoa discharge, then you start thinking, kuna maneno huku ndani. Unaanza sabuni, habo, steaming. The people do steaming. That organ is the cleanest. Sawa. It cleans itself. Don't clean. The farthest you can go, is the vulva. You can just pat it kidogo. Then just yes, water fresh. Sio ya Mombasa. Fresh. Sasa, let me ask you. That water, if you can't put it in your mouth, it should not. What I mean is the salty, yes. Mombasa, water is very dirty. You go to the ocean, what people do in the ocean. Have you gone behind big hotels, Chuda, Wende pale nyuma? You'll find the sewage going to the ocean, yes. But it don't, sioshe huko ndani. Ilioshwa wakati wa creation, Endometriosis. Endometriosis is you've said everything about endometriosis. We'll be here until 7 p.m. Because endometriosis, there's so much about it, and we know nothing about it as doctors. I will explain what I mean. You know when you come with malaria, what causes malaria? Mosquito. Then there's a plasmodium. So unapatiwa dawa. Ukisema una malaria, unapewa dawa, the same medication. If you have pneumonia, kuna dawa unapewa. Because we know the cause. Endometriosis, we don't know the cause. Hata fibroids, we don't know the cause. What we have is just theories to try and see. Ni kama useme, okay, wacha turudi tu hapo. So, we think about hormones. We will tell you ni mambo ya hormones. Tutakwambia ni genetics. Maybe your mom or your auntie or your grandmother had endometriosis. Ama fibroids, that's why you have. So we still have theories to try and explain, but you don't know the cause. So if you don't know the cause, how are you treating it? So endometriosis, we treat symptoms. Okay? Now, in this drawing, you remember the cells, remind me if I'm off. Yes. You remember these cells? They are called endometrial cells. Endometrial cells. That's why you ugonjwa inaitwa endometriosis. So during your period, kuna viti hapa. There are seats here. So during your menses, these cells are the ones you shed, zinatoka kama damu, si ndio? Now endometriosis, these cells, you find them somewhere else, not in the uterus here. So you find them in the ovary, uko. You find them in the fallopian tube, so it can cause infertility when it's there. You can find them behind the uterus. You can find them just next to the vagina. You can find them in the vagina. You can find them in the lungs. You remember Njambi? Yes. She had endometriosis in the lungs. And you can have them where? In the brain. So, when you're having your menses, that inflammation, pain, and everything that happens in the uterus happens where? Where those cells are. So kama ziko kwa chest. So the same happens in the chest. But hazitoki, hazina outlet. Uterus iko na outlet. So your chest inabaki. The lungs, the brain, the ovary, and the the fallopian tube. So the symptoms that you get for endometriosis, it depends where those cells are located. So if it's in the chest, you get, every time uko na period, unapata severe chest pain, una cough, some even cough blood. If it's behind the uterus or next to the vagina, every time you're intimate, you have pain because those cells are there and they're not supposed to be there. So the symptoms depend where they're located. Treatment, there's medical treatment, then there's a surgical treatment. Not everyone you treat the same. Sawa sawa. I hope I've not very satisfactory, but see, I've tried. Exceeding expectation.
Maybe just to add, like you said, endometriosis is, do you call it the elephant in the room? Something we would like to address and treat fully, but it's really hard. Like you said, it's everywhere. So basically, right now, we are treating what we said symptomatically. The symptoms you present to us, if you're struggling to get a baby, most of the time we'll actually recommend that you go straight to IVF because you'd like you not to waste time by spending so much money, taking so much medication, while maybe the tubes have already been blocked by the endometriomas, the small tissues that Dr. Karanja has talked about. Sawa sawa. But it's something that we hope we can be able very soon to treat. It's becoming how do I call it? Like it's getting more complicated. As recent as of, I think 3 days ago, a colleague of ours actually saw a patient with endometriosis here. So you can imagine every time they're bleeding, kuna damu pia inatoka on the wrist. I think you saw that. So it's something we are really trying to. Have you ever seen that meme where you're saying you're trying so much to lose weight and then there's a cat, something running behind it? Mshaiona hiyo meme? You're running and then somebody's, yes. So that's what we are doing with endometriosis. Every time we think we have a breakthrough, something comes up. Sawa sawa.
So we can.
Yeah, we can take more questions on because I know endometriosis it's so big. Vile daktari amesema tutatoka saa moja, but at least he has shed light on a few parts of endometriosis. Next, we are going to take about three more questions before we can proceed. Okay, we can have 1, 2, maybe 3. So we can have 1, 2, and at the back, sawa sawa.
Okay, my question is, what of like during or before menses, you get to have a lot of sharp backaches, like mgongo kuuma sana. Sometimes hata you can't actually kuamka ama huwezi tembea, like it's just severe. Is it normal or it's not? Yeah.
Thank you. My name is Caroline, and I would like to ask if you can talk about PCOS. I don't have much information about it, but what is PCOS? Maybe how do someone get to know wakonayo, how to manage, or how to go about it? Are there signs? And also, maybe there's something I heard that. What is it called? Cervical cancer is among the top cancers zenye zinaua watu. So, and it has a vaccine, the HPV vaccine, but I know there's an age, when two girls na boys, ndo that age ndo wanapewa the HPV vaccine. For us who maybe never got that vaccine and we are past that age, is there a way maybe we can get the vaccine or kuna venye tunaweza kuwa salvaged?
Hi, my question is probably in two form. And one is again, about fibroids, which is almost in the same class with, close class with endometriosis. At what point does one need to check out if they are having fibroids, especially when they're having painful cramps? At what point should you maybe go and check it? That could be fibroids that are probably, disturbing you. And then two, is there a way, we have heard the way you can shrink fibroids also naturally with different herbs, thanks to our grandparents and others. And so there's something that maybe you want to know, like the shrinking of naturally, does it also include probably in between bleeding that is not your periods? Yes, or maybe how do you get to know that the fibroid is shrinking? Just hold up.
Let me start from behind. Your question was on fibroids or endometriosis, or both? When to check? You're supposed to see your gynecologist minimum every 2 years. Every 2 years. Unakuja tu unasema, Dr. Karanja vipi? Nimekuja. Annual, you see the way people do annual checkup? Blood pressure, screening. You're supposed to see your gynecologist every 2 years. Not when you're pregnant. Not when you have a bleeding problem. By that time, the problem has already happened. That is when the fibroids will be picked. That is when the endometriosis will be picked. But let me assure you, majority of women with fibroids, majority of women with endometriosis live their life without any struggle. No symptoms, no nothing. When they get pregnant, you do a scan, you find a thing there, a fibroid. Kamekaa tu hapo, hakana story. And they deliver normal. And you don't touch them. Even us, we fear fibroids. Because if I come and remove it, after 2-3 years, they come back. So we only operate on a fibroid that is causing havoc. Unaweza kuwa na fibroid ni kubwa, people keep on asking you, utazaa lini? Mbona uzai? Clinic umemaliza ama bado? Because it's become big na inaonekana. Or you're bleeding too much, blood level inaenda chini, you have to be on drugs every day. Or you're having severe pain, or you're not conceiving if they are blocking the tubes, or you're getting pregnant and you get recurrent miscarriage. Those are the people we treat. Otherwise, ukuje tu na ka fibroid ka 2 cm, wewe uko tu sawa, unachapa job zako. Takusalimia tu. Kwambie bye bye. But there's another question you asked. Now you can imagine you've come see me, you have a fibroid which is 2 cm, no symptoms. So what is the question you'll ask?
How can I manage?
Yes, because after 2, 3, 4, 5 years, it can grow. Sindio? So what should I do? You've talked of the drugs that can shrink. Herbal medicine works. Should I repeat that? Herbal medicine works. But which herbalist? Mnanipata? Unanielewa? We have so many people walking around with madawa wakizunguka. The reason why when you come to Karanja or Mitei, they will not give you a herbal medicine. I don't know what it contains. I don't know the side effects. I don't know the dose. Utaambiwa hii kunywa. Ukiamuka tu, ukisikia una sweat hivi, it works Our forefathers used herbal medicine and it used to work. But we don't know the dose and everything. That is why we don't advise you to take. But if you get someone who's gone to school and learned about herbal medicine and they know what they're doing, it works. Yes. Now, when you come with a fibroid that is small and you don't have symptoms, what I'll tell you is this. If I receive 10 women with a 2 centimeter fibroid, 5 of them, it will just remain there. 2 centimeter. After 5 years, you do a scan, it's 2 centimeter. 2 of them, it will increase in size. And the other 2, it will dissolve and disappear on its own. So who should I treat? Sorry? The one which will increase. How will I know the one which will increase? Just give them time. Yes. Just give them time. Because you can't treat 10 people to treat only 2. Sawa sawa. That's why sometimes tutibu ama tusitibu, lakini ukija kwa daktari unataka utoke na prescription. Melipa consultation 3,000 na sina dawa. So I think
So the next question was about HPV. I'll tackle PCOS later, just as soon as we've talked about HPV. Now, the vaccine is very important, okay? We are giving it to the girls between the ages of 9 to 15. We would like to push it further, like you've said, to ages higher than that. However, nakumbuka sisi tuna depend on being given things from being funded, okay? So this specific age group was chosen because they are at a higher risk, because their cervix is still developing. And when something is still developing, just the same way when you are a child, when you observed things going on around you, tend to absorb. So the same thing happens with the cervix at this time. It easily picks up the HPV virus, and then later, which could be even 20 years later, is when it starts showing changes of cervical cancer. And it's not in everyone. You could have picked the HPV virus, your body got rid of it, and then eventually you don't get the cervical cancer, or it could happen that you're the percentage that will actually then develop cervical cancer from the HPV exposure. Sawa sawa. In other countries, they actually do tests for HPV, especially the ones that are notorious. So there are many, but 16 and 18 are the ones that we talk about. So the same way I'm called Miteichepo, again, there's somebody else called that. So those specific 2 are the ones that we say are very notorious for causing cervical cancer. If you get tested and they are negative, you can actually get the vaccine. Okay, because it actually means you've never been exposed to this HPV. The catch is, we don't do it here. So if you ever traveled abroad and you had a chance to actually do the test and you were given that vaccine, it's a very good thing. It's actually free in those countries. So the only reason we limit to this is not because it's not eligible or we are not eligible for it once we are past that age. It's just that it's funded and it's subsidized. So we are targeting the group that is the most at risk. Now, the reason I said I'll answer this question together with Karanja is, did you know boys can also get vaccinated? Yes. I'm seeing just one person shaking their head yes, which I hope you're not Indian and you mean no. And I'm seeing other people saying no. So yes, boys can be vaccinated, and I'll let Karanja talk about that. But they're the ones who are giving it to us.
The boys are giving to the women, between the chicken and the egg. So, now, anyone who's ever had sex? Anyone who's ever had? Sex. More than 90% have HPV. Let that sink. Sawa. Let that sink. I wish our parents were here. No, I will omit the sex part. Now, but our immune system, majority, 95% of those who get HPV, their body fights the HPV and it clears the HPV. Only a small percentage, like 5%. And she's mentioned we have so many types of HPV, but type 16 and type 18 is the one that causes cancer. And that is the one that we test. And we test it if you are above 30 years. If you're above 30 years. Again, because if you're very young, 20, 21, 22, and you've had sex, 95% of you, the body will clear on its own, bila dawa. So why should I test all of you? Ati tufanye HPV ya nyinyi wote because of these two. Oh, not you, not you. You understand? So the reason why you target 9 to 15 years is because 9 to 15 years, almost 100% have not had sex. Sawa. But if you are 30 years and you're a nun and you've never had sex, you can be given HPV vaccine. Tumeelewana hapo? If you've never had sex, you can be given HPV vaccine. If you are 30 years, you're married, you've had sex uncountable times, maybe your partner also has other partners. I'm talking about real life. Your partner has several partners. Go get tested, as she has said. If we find the HPV is negative, the one that causes cancer, look for us. We will give you the vaccine. Should I repeat that? Ukienda upime HPV, upate iko negative. We call it high risk HPV. Upate iko negative. Enda for the vaccine. But tutakupatia hiyo vaccine chini ya maji. But at a cost. Not, that's why she was talking about the donor funded. You know, donors come with instructions. Do this and this and this. Yes. So it can be given. And the reason you give the HPV vaccine, cervical cancer, you will know you have cervical cancer when it's stage 3 and 4. And the treatment is just palliative. So the earlier you screen, the better. Now about the boys can also be given the vaccine. Okay? The same age group. The ones who've not had sex. And the HPV can also cause cancers even in boys, penile cancer and those other things. So make sure you have your vaccines. Sindio?
Come, we screen you. You see the services we offer? Down there is cancer screening, okay? I know a lot of you have had, ukienda kupimwa cancer, kuna kitu naingizwa ni chungu. It is not painful, it is uncomfortable, okay? If done okay and correctly by people like me and Karanja, clap for us. You will not feel pain, okay? Because we take you through what to expect. And when you know what to expect, then the procedure becomes less uncomfortable. And I just don't do it without telling you what I'm about to do. So we are very gentle and we take you through the procedure. And you can always say, can I take a breath? So we are not going to take you in a hurry, because we want you to get the screening done in the most comfortable situation possible. Sawa. Now, the question about PCOS. So I'll talk about it. It's another topic that is wide, but I'll talk about it very briefly, starting with how do I know I have PCOS? Most of the time you will not know you have PCOS. A lot of the clients we find who have PCOS have either come to us for two reasons. Reason number one, they're looking for a baby. Reason number two, their periods are nowhere to be seen, or when they come, they're so heavy, or it's one day, like their periods are really messed up, for lack of a better term. Those are the only two times we get patients who have PCOS. So nobody ever knows they have PCOS, okay? So the symptoms are this. You'll have very irregular menses, so you're not able to tell how your cycle is. It could be 35 days today, then they go missing for 3 months, then they come back. You understand? Not the irregular of 28, 30, 27, no. It's the irregular of sometimes it actually disappears for a long time. 3 months, 1 month, you just do not know exactly when you get your periods. Some people have very heavy menses when they get those periods, and some people have just one pad that is not fully soaked, and it's for a day or two, and the period is over. Okay? So what we normally say is just abnormal menses. I will not tell you longer menses or shorter menses. It's just abnormal menses. Most of the time, it's painless, but you could have pain as well, okay? Most of the time, it's painless, but you could have pain just like somebody else who has no PCOS. However, they're getting cramps because of their menses, okay? The other thing we tend to see with a lot of patients who have PCOS is acne, okay? So pimples on the face, the chest, and the back, okay? And then a lot of them will have a hair or two growing on the, that is noticeable or not noticeable. So you could be the only one that sees it, or you could even be plucking it out and then it grows back, okay? So some people have that, and not everyone that has hair on the chin has PCOS. I'm just telling you all the symptoms, okay? Because sometimes you could have hair and you do not have PCOS. Remember, I'm giving you all the symptoms. Okay, there is a criteria we use to say if you have 3 or 4 of these symptoms, then highly likely you're having PCOS. Okay, so not just because you have one symptom, then I'll say you're having PCOS. The other thing is we tend to see a lot of women who are heavier, so we call it central obesity. Sawa? Una kiuno, melewa. You're big or just central obesity. We tend to see it a lot with women who have PCOS. Reason being, the central obesity, or rather the fat that is stored here, tends to cause hormonal imbalance, especially affecting the hormone estrogen. And when one hormone is affected, what did we say? It affects the whole thing. So it will affect your menstrual cycle, okay? Those are the symptoms. And sometimes one is rare that we see, but it's also a symptom. Your voice breaks, yeah? You unakuwa na bass. Instead of speaking like a lady, you're speaking like a gentleman. Okay? Remember I said it's rare. Okay? Sometimes, can you believe it? Sometimes you have none of those symptoms and you come to us and there's a test I will do and then I tell you have PCOS. That test is a pelvic scan, or the one that we are taught in school, that it's the gold standard, is one we call transvaginal sonography. I think this has gone off. Yes? Am I correct? Yes, it has.
Oh, kuna mmoja unasema hamkujibu ya mgongo, ile kuumwa na mgongo before the menses.
Oh, kuumwa na mgongo. Any pain that is bothering you is not normal until the doctor says it's normal. So it could be a fibroid, it could be endometriosis, which roams around everywhere, or it could be just the inflammatory process that happens when you're having your menses. Yes, or close to having, yes. Before, some have after. And there are those who have very severe symptoms before their periods. Periods ikikuja wako sawa. Even that one should not be symptoms that make you not perform your normal. Si lazima uperform every day. Saizi maisha lazima utafute. Otherwise kasongo Nafanya mambo.
Okay, so we have there's one question that was asked on fibroids and social media bado kumeulizwa. We have two that are closely related. Number one is, how does fibroid cause recurrent infection? And the other one is, can fibroids be treated with herbal alone? Yeah.
Yes, herbal can be treated. No, herbal? Fibroids. you know, scientists, we have a problem with herbal, but they work. Yes, herbal can be treated. Fibroids can be treated with herbal alone. That is a true statement. But it matters a lot who is giving you the herbal medicine. So, the other one was on fibroids.
Can they cause recurrent infection?
Not a direct cause. No. Fibroids they're not infectious. They don't cause an infection. Not unless it makes you bleed like for 2 weeks and pads and everything. Maybe that can predispose you to get an infection, but they don't cause an infection. You've just made me remember the question behind there. You had asked if the fibroids are dissolving, how can you can't know when they're dissolving. There are many women, when they come to the clinic, wanasema, akizaa, kuna mama mwenzake alimwambia wakati alizaa, fibroid pia ilito, hiyo ilikuwa placenta. Sio fibroid, ilikuwa placenta. So, haitoki, ina shrink. The body absorbs it. Hakuna mali ya kutoka fibroid. Sawa. So ikiyeyuka ina dissolve ndani. Hakuna mali inatoka inaenda. So you can't see it. Sometimes you can have a lot of discharge. Then daktari yule alikutibu na herbal anakuambia ni hiyo fibroid ilikuwa inatoka. Then if you are treated with herbal na umeambiwa umetibiwa fibroids, usifanyie scan hapo. Enda ufanye scan kwingine confirm, because anaweza fanya scan na andike report hakuna fibroid. So you'll be singing hallelujah that you don't have fibroids. Then you know Kenya the way it is, huh? Yes.
Before hata uketi, kuna ingine pia ya msee ameuliza, I bleed continually until I take Femiplan, but I'm young. Can I be normal? Na hiyo inafanana na, is it true that P2 pills, I think they are both on contraceptives, so is it true that P2 pills never get dissolved when taken, and when they get stuck in the womb till they are flushed out?
So anatumia Femiplan to stop the bleeding. Akistop the Femiplan, bleeding inaendelea. Again, as gynecologists, people come to see us when it's too late. They have gone to everyone else. Amelipa pesa mingi. Then at last they come to the gyne. Now, many women who bleed, I can assure you, kama una bleed for long, uende umwone daktari ambaye sio gynecologist. Majority atakupatia dawa ya family planning. Maybe even some of you have been given. Unaambiwa hiyo ita balance hormones. Yes, it's treatment, but it has specific indications. So lazima afanye tests, hakikishe hakuna fibroids, hakuna infection, hormones ziko sawa, kila kitu, ndio sasa upatiwe hiyo ya ku regularize the period. So pills can be used, but when you don't have a cause, you've not found the cause, then you can use the pills. That's why unaona anatumia, then akistop, the problem comes back. Yes, it's like when you have a headache because of malaria. If I give you Panadol, si kichwa itatulia, but malaria bado iko. So once the painkiller imestop, kichwa tena ita. P2. Ukikunywa P2. Unajua P2, eh? Tunajua P2. The emergency pills, eh? The morning after. Hawajui? I explain? It's the pills you take as an emergency when you have, it's accidental, eh? When you have sex and you don't want to get pregnant, then you take emergency pills. Now the emergency pills, wanauliza kama inakaa kwa mwili, dissolve. No, it dissolves. It dissolves. Ni kama ile family planning ya sindano. Ukiitumia for long, utakaa like 3 months, you are not getting pregnant. Wakati you may stop, you might take long before you get pregnant. But P2, if you take P2 today, itazuia hiyo sex ya hiyo siku. After 1 month, kama dissolve, inamaanisha you should have sex like 6 months. Ita control. That is what it means. Kama dissolve. So it dissolves na mwili inaitoa within 48 hours. Yes. Hakuna P2 ya mwaka mzima.
Contraceptive. So we can also have one. Is it normal for someone to have an order a day after copulation? And Dr. Mitei, utatusaidia.
Tulia, ni odo. How do you pronounce it? Ada, odwar. So yes, it's normal. Remember when I was talking about vaginal discharge, I said if it's offensive, it is not normal, okay? So don't go flashing out and trying to spray things to try clean yourself up. We've already agreed very well with Dr. Karanja that the vagina cleans itself, okay? So the same way, if you have sex copulation, I don't know where she or he got the term copulation. It's a very scientific term, but it actually just means having sex, okay? So having sex, the sperms sometimes tend to hide behind the cervix. Kuna mfuko tunaita fornix, okay? So all of it might not come out on the same day that you had sex. If it stays, yes, there will be a certain smell, but it's not supposed to be offensive, and it's not supposed to have those colors that I told you are not okay. Sawa? Na tumeagree hakuna kuosha. Sawa? I've had women who come and tell me, unajua daktari nilikuwa najua nakuja kukuona leo, so nilikutana na mzee jana, so nimejiosha lakini ukiangalia uone kitu nielewe. I'm like, I don't mind seeing it. Okay? I don't mind seeing it. So you don't have to wash and do things to yourself. Okay? The other thing is, when you're coming for any screening, do not be worried if you're having a discharge. Do not be worried if you have not shaved. Even if it's cute, handsome, Dr. Karanja examining you, believe me, hata judge. Okay? So, yes. Please just come as you are. Sindio? Si hata Mungu anasema, usishake kichwa, come as you are. Do not start preparing, hey, sasa sijui unajua niliona Mitei. By the way, when we're at work, we hardly remember the things that we see. I can see you today. You walk out of that door, I'll meet you down there. Believe me, I won't even know if you've tattooed your Miss V or not. I won't remember. I will not remember. Sawa sawa. I am very sure. Karanja wo kumbuka. Do you remember how they look? We don't. And we are not saying to please you. It's actually the truth. Sawa? It's the same ukienda salon. Saa zingine unaendanga kwa salonist wako unamwambia, nisuke ile nywele ulinisuka December. Do you notice they don't remember? Yet you've been going to them regularly, right? It's the same thing for us. We don't keep records like that in our heads. Sawa sawa. The last question before we throw back at you again to ask more questions if you have, is somebody asked, how do we treat all infections? That's a very wide question. But all infections have different medications. If it's caused by a bacteria, highly likely we'll give you an antibiotic. If it's caused by a fungus or a yeast, we'll treat you with an antifungal. But remember, you cannot tell if it's a bacterial or fungal until you see one of us, and sometimes we are even forced to take you for tests to actually be sure what you're having is what I think. Sawa sawa. Thank you.
There's one treatment for all infections, all fibroids, all endometriosis, almost all diseases that doctors will not tell you. Can I tell you? It's diet and lifestyle changes. Sugary foods. Sugary foods. Na Mombasa ziko mingi. Ukiteremka hapa unakutana na nini? Viazi karai. Ukipita hiyo kona unakutana na mitai. Inaitwa mitai. If you cut on your chapatis, must you eat chapati? Chapati, anything wheat. Anything wheat, take it on Sunday only. Siku ya kuabudu tu, nakula chapati. I'm serious, by the way. Sugary foods does not mean sugar ya kuweka. Sugary foods is anything that has carbohydrates. That is sugary food. That's why mtu akuna shida ya sukari anaambiwa usikule rice, kula ya brown, kula nduma, kula. Carbohydrates is poison. Carbohydrates is poison. Cut on your carbohydrates, fibroids it reduce. Cut on your carbs, endometriosis, infections, all those things. So that is the treatment for infections. Yes. Wachana na wheat. Wachana na wheat. You see all those products, they will tell you nice names like cholesterol free. You know the seed oil? Unaambiwa ni cholesterol free. Ama ile Coca-Cola inasema zero sugar. Damn. It's not zero sugar.
Semeni ask your gyno.
Ask your gyno.
Ask your gyno.
Ask your gyno.
Leo mmepata free consultation and there's still more consultation coming. I know it is a burning question, but right now, actually, I'll hand over to my partner, then from here, she will now throw it back to you. Sawa sawa?
Hamjambo tena. Tumepata wageni tukiwa tunaanza. Wametujoin baadaye. Wageni, mmetoka cathedral ama nyinyi ni wageni wetu? Hamjatoka cathedral na nyinyi pia? Karibuni sana cathedral. Hapa we care about your spiritual and health matters. So anyone who has scanned that QR code? Who has scanned the QR code? Nani amescan? Please make sure you do. Find time to scan that QR code. That will make sure that you are in our list. Next time we have a talk, nyinyi ndio wa kwanza tutawaita. And also, sasa wewe ukiwa na posta yetu hata before tupange, tutaita mabeshte zako. Everyone needs to know about their health. Si ndio? Hautaki ukana beshte yako hapo na anatatizika and then ghafla binvu, now you have to changa for you or sijui nini. Ungekuwa tu umejua, si ndio? So make sure you find time to scan that QR code to know more about your health and ask your gyno. Vitu zingine unaweza uliza tu kwa WhatsApp, si ndio? Alafu ukapanga schedule hapo na daktari na ukaenda ukamuona. Sawa sawa? All right. So the next thing we want to do is we want to take questions from you people. Any question that has not been tackled in our topic today? Menstrual, fibroids, PCOS. So who has a question that has not been talked about today? Thank you. Who is shy and they need a paper to write? We give you a paper. So if you are shy, ask us, we'll give you a paper. Uandike.
Okay, I'm not shy. I'm from Woman Bold Up. I'm not shy. Now, here's my question. What's the consultation fee at your clinic? Like, what's the consultation fee? What do you need to come there? Like, tell us more about it so that you can tell the others to come over there. You get it?
Atajibu za mechi consultation we offer all these services. Consultation is 2,000. Sorry? Yes, 2,000. 2,000, not dollars, Kenya shillings. Then we also do antenatal clinic. Antenatal clinic, we mean when you're pregnant. We usually say when you're pregnant, and for those who've not conceived, the moment you know you're pregnant, hata kama ni one day, you go to the clinic. Don't wait for 5 months. Utaambiwa ngoja mtoto akuekue 5 months ndio uende kwa clinic. First trimester is the most sensitive and the most important. Some of the problems that happen later is because first trimester was never handled well. So we do antenatal clinic, fertility clinic, the questions you've asked. Why am I staying with a guy for 1 year, we've not conceived? Some will come after 2 weeks, they've been together for 2 weeks, and they have not conceived. We have family planning. You know why they come? They come because the guy came, they got married, they did a wedding. After 3 weeks, the guy is traveling abroad. So wanataka kushika mimba hizo wiki mbili. Mitei ya pambane. We have family planning, that is contraception, all kinds of contraception that you want, including the natural method. Although when we tell you about the natural method, we have to tell you it's the most ineffective. You have to be very disciplined. Can I explain why? During your ovulations, the hormones that are produced, that is when your libido is. You'll find yourself naturally. Unakuwa tu mzuri. And then Dr. Karanja is telling you that is the time you avoid sex. So you have to be very disciplined. When I say during that period, unalala bedroom, mzee analala sitting room, I'm very serious because things happen. Then when you come to the clinic, we take the first 10 minutes, you're just smiling, you don't know what to say. Unasema daktari ulindanga? We do cancer screening, cervical screening, very important. Breast cancer screening, if you're above 30, very important. There's a reason why we do screening for specific cancers. Ushawaisikia screening ya head cancer, brain cancer? Very rare. They are specific cancers. And those cancers that we screen is because there's something we will see, then we can predict in the next 5 or 10 years, if you're not treated, you will get cancer. Screening is not to check for cancer. Screening is not to check for cancer. It's to check if you're at risk of getting cancer. Then the last one is the ultrasound scan. That is now every gynecologist you see will send you for a scan so that they can see these beautiful organs. These ones. They look beautiful on the scan. You can even come, we just see it on the scan. The natural ovary, uterus, sawa. Those are our services. The other question was... Yeah, she will handle the menses and the mental. No diagnosis, just painkillers. Every month you are just on. There are those women who come, they have very severe menstrual cramps. We do a scan, nothing. We do all the tests and we find nothing. Those ones we just call it dysmenorrhea. So most of the time you can be given just painkillers during your periods, or we can give you some hormonal drugs to try and alter the hormones, or we can give you what we call anti-inflammatory drugs so that you don't have those severe symptoms every month. But if you use painkillers only when you're having your periods, has dinner side effects. But you've heard of brufen? You all know brufen? Diclofenac? Those ones are not the best to use every month because they can cause acidity, ulcers. So you'll find wakati uko kwa period, unapatanga ulcers, unafikiria inaenda na period, kumbe ni madawa zile unatumia, so inashinda ukichomeka chomeka. So there are specific drugs we recommend. So if the problem persists, you go see the gynecologist. Yeah, I think I've... The others?
So mental, ama unataka naambiwa nianze na ya mechi. So hizo mechi zikishachezwa, those, you remember what Dr. Karanja was saying? Majama wengine wanapenda kukimbia na wengine wanaenda polepole. Wale wa kukimbia, trust me my friend, watakuwa shafika mbali sana. So no matter how you clean yourself, even using a hose pipe, it won't work, okay? Kuna mwenye atakuwa ashaenda, ameshachangamka, okay? So that is not going to help. Then the other question you asked about, sometimes unaangalia panty imechomeka. So the discharge we have most of the time is acidic, okay? If we did about a bit of sciences and chemistry, remember acid burns, eh? So it causes the panty to turn brownish, okay? Or that part becomes weak, or that's the part that tears on your panty. So that's normal. There's nothing wrong with that, okay? So if you see it brown and nini, just know it's the discharge that is acidic that is causing that to discolor your panty. Now, going on to mental health and menses. Yes, menses affect your mental health. Once you have pain of any kind, be it menses, be it you're just having headache, be it you're just having malaria, a flu, that already disturbs your mental health. Remember when Dr. Karanja was talking about menses, he drew this girl here. You see the brain? So yes, and the brain was the one that tells everything else to function how. Sawa? So yes, it is related. If it's really causing you trouble to a point where maybe you're not able to give your all at work or in college, in school, then we need to talk about it so that we easen that off and you can focus on whatever that you need to do. But yes, it does have a relationship. Let me give it back to you, Eunice.
I have many questions for you. But tuonana nyuma ya tent. Ask. Like how frequent do you have sex? How, those are maswali ya personal, eh? Sometimes when you go see a gynecologist, sometimes you'll also wish your partner not to be there because there are some questions about the past that we will want to ask. And we are human beings, eh? We are not holy. We are not holy. There are things you can tell your gynecologist and you cannot tell your partner. I know we are in church. The Bible says we should. But we are also in this world. Tunaelewana hapo? Let me not go into the details. But when I mentioned about if your cycle is 28 days, you can go the natural way, the way you've been doing it. But you've also mentioned that Sometimes that is where the gynecologist, hapo ndio gynecologist huwa anajitoa. Anajitoa upate mimba. Because those few days, 5 days, and you see, huwa mnatembea, the boys can identify with this. Boni na J. Ukiona mahali, hata kwa mtaa hapa, ukiona mahali imeandikwa usikojoe hapa. When you pass there, what smell do you get? That's where people do. So when she tells the man, sasa the next 5 days, hakuna. Hapo ndio sasa unipendi sijui nini. That is what happens in real life. And the two of us are gynecologists. We see this every day. Most of the pregnancies we see, people who are married, they were not planned. They were not planned. But tunasema kameku ni Mungu na maisha yanaendelea. So it works. It works. If it was possible to do the natural way, even me as a gynecologist, I will not advise you to use, because most of them are hormones. So what we do, you look at the benefit versus the risk. What is the risk of getting pregnant every year? Every year you're pregnant. Every year you're pregnant. Instead of using contraception, unaweza ongeza weight kidogo, unaweza punguza weight, you can get acne kidogo, but you plan your life. You know that the next 4 years, nimeshazaa, the next 4 years, nataka niende shule, nifanye masters, nipate cheo, then after 4 years I get another one, ndio niweze kuafford international school, si ndio? Lakini wakikuja tu hui. So you have to weigh all that. I forgot to commend you on the herbal. I still insist herbal medicine works. Herbal medicine works. But it depends who is the prescriber. Nani ndiye anaandika hiyo herbal medicine. Sawa sawa.
Is it normal to have cramps this month and the other time no cramps? So as you're thinking about that, I'm going to answer this question. I have never used family planning before. I want to try using IUD is intrauterine device or the coil in simple terms, but pain is where I draw the line. Oh, me too. Can it be done under anesthesia or what do you advise? Okay? So we don't do it under anesthesia, but I'll insist on what I said when I was talking about cervical cancer screening. I said it's uncomfortable, but it's not supposed to be painful. So if you get a gynecologist who needs to be very patient, okay, explain to you the process, exactly what will happen and what you should anticipate, then the procedure does not become painful, okay? Because we cannot apply anesthesia to the entire vagina. Remember when Karanja was showing us the lips? He said the vagina is there. So it's the tube. For lack of a better term, it's the tube. How do I apply anesthesia to the whole tube, and then to the cervix, and then to the whole uterus? It's hard, right? So it's not possible to do it under anesthesia. However, it can be done gently, right technique, and it can actually be as comfortable and no pain at all. Sometimes I actually ask my patients to breathe through their mouth. It helps relax the muscles in the abdomen, and when that happens, even down there relaxes. So I'm not struggling to push the speculum, because the pain comes when you're trying to, naelewa your feeling, and I'm also trying to, what happens? We are counteracting our forces, so most definitely you're going to feel the pain. Remember, the speculum is like this when I'm inserting, but I have to open like this. If you're squeezing, what will happen? You're squeezing my speculum, it can pinch the sides of your vagina, and that's when you start feeling pain. That's why I said you can always say, stop, I need to breathe, okay? and then we will stop and begin again. Si ndio? Haya. Kuna 2 minutes, mic inachukuliwa.
If you really need anesthesia, again, you can come discuss with your gynecologist. It can be offered. But of course, at an extra cost. Even labor. We have women who labor without pain. Yes, you labor without pain. You give what we call epidural anesthesia. Uko labor lakini unachapa tu story. Yeah. Unachapa tu story. Si story za jaba. Now, cramps. Yes, you can have cramps when you're not on your menses. And the normal cramps when you're not on your menses ni ile ya ovulation. You see, day 14, if you know your cycle well, during your ovulation, most probably 80% of you gets some little discomfort on the sides, some little pain. For some, unfortunately, the cramps are very severe. It should not last for more than 2 days because you ovulate only for 1 day. The other question on cramps, there were 2 questions on cramps. If you're not ovulating, if you're not, that can happen. That can happen because of the hormonal changes, climate, and everything, stress levels. There are those who've never had cramps in their lifetime. Never. Anasema anasikianga tu kaflow tu kana. So wanakuja kuuliza, are they normal? Because every other person akona cramps. If you've never had cramps, just continue praying and thanking God. God doesn't have to bless you with a V8 for you to thank Him. It's the small things in life, like not using a contraception and you don't get pregnant. Thank you.
I tell your neighbor behind you, ask your gyno. Na ule wa kando yako tena mwingine, ask your gyno. Sindio, ask your gyno. They are here, they are available. And once again, I'd like to remind you, make sure you scan that QR code. Iko hapa na iko pale mlangoni. Please scan it. Specifically hii yenye iko kwa posta ya color pink. Hiyo nyingine ni ya maswali. So if you want to enter into the database, scan ile iko kwa color pink. Sindio? So we are about to wind up. And before tufunge, who has learned something they did not know today?
We have to stop taking the wheat, like the all carbohydrates in nini, like they are not healthy. And venye amesema, an apple a day keeps the, yeah, so at least getting it from you inanipatia ile confidence than mtu kusema tu unajua ukifanya hivi na hivi na hivi na hivi. So at least now I know. Yeah.
Frida, acha kumwangalia mwenzako hivyo. Ndumas are expensive. Yes, they are expensive kushinda chapati, but they are healthy. Si ndio? Anything else? Anything else you'd like to wind up?
Hey, beautiful ladies. My name is Nzisa Malay Caroline. Something that I have learned in this room today is we really have shame around our vaginas. We also have shame around our reproductive health and taking responsibility. Reason why I've mentioned that is because I run a women empowerment initiative called Woman Build Up, and we teach women how to be confident in all areas of their life. I've not said this simply because I feel like I am not shameful myself. However, I feel like I should just share we should not be shameful for our reproductive health and our vaginas. Thank you.
Okay, what I've learned today is that not everyone ovulates on the 14th day as it's posted out there.
Cycles ziko tofauti, si ndio? So we kama cycle yako inaruka, Usifikiri unaweza cheza safe days. Mi hiyo ndio kitu nimelearn. Alafu nimelearn safe days si eti ni safe kweli.
So I've learned a lot, and maybe I just want to ask something. So for us, tumeza kuelimishwa, and we know we should come for our gyna visits every 2 years. For our younger sisters, when you wanna grow, for our moms who don't know when they should start bringing their girls, for those of us maybe we are moms, how soon should one start bringing their daughter, their younger sisters for the visits? Na miaka ngapi hivi?
So how soon should your sister or should a lady start visiting a gynecologist?
Soon is, how do I call it? Let me call it subjective in terms of if you have a 3-year-old with a reproductive health issue, then it's soon as you find out. So sometimes we have children who are born with what we call the hymen is not open, okay? Those ones. So as soon as you see something, it does not matter the age and you think it's abnormal, bring your sister, your daughter, or your younger sibling for the gyno to see and tell you if you need to do something. However, if everything else is okay, then we recommend at least from 9 years, even if they've not started their menses. Remember, we've said you don't have to come see Karanja because you're sick. Sometimes you are coming to see Karanja to have a conversation. So at 9 years, this child is already, right now, kitambo ilikuanga 12, 13. Nowadays, we see girls getting menses as young as 9. So that's the time you need to start talking about menstruation, hygiene, and high-risk behaviors. Haven't you had teenagers as young as 12 getting pregnant, having a lot of other things on the side? So as from 9 years, I think it's even taught now in CBC from, is it class 5, if I'm not wrong? So yes, as soon as 9 years, we can have that conversation all the way to until they're out of adolescence. And the conversation for you to make your sibling or your daughter comfortable, just tell them it's just to understand your body. And nowadays, I advocate for you to call the vagina, and the penis, okay? These things of dudu na nini does not work, okay? Children do not understand that language. That's the time we start telling them somebody should not touch your vagina. You actually draw, this is my space, not yours. So somebody should not touch above your knee, below your neck. So you teach your children that way. Have I answered your question?
And maybe not to medicalize so much on menstrual hygiene and everything, because you can imagine a 9-year-old unampeleka kwa gynecologist. The first gynecologist is you. Most of us here mulipata periods and you've never had a discussion with your mother about, umejua tu kwa mtaa, ama maybe ulikuwa tu class and something happened. So normalize that vibe. Talk to them. Ukimwambia tunaenda kwa gyne, mimi si mgonjwa. But ukianza kudiscuss mapema, period inakuwaga hivi, twende sasa, after some time, now you go see the gynecologist. Asione kama periods ni ugonjwa. Sawa. Then, talk to your kids. They know stuff. They know. Call the penis, and call the vagina. Dudu ni ile inatembea huko nje. Tunaelewana? Because they will feel like this thing, yanajua dudu ni ile. Hii mbona inaitwa dudu? Ni kama kasiri mahali, you know? Normalize communicating with everyone. For those of us who are uncomfortable, maybe you're still young, you're uncomfortable talking to your mom, you have your best auntie, you have your best, we're in church, eh? There's the spiritual mothers. Ama mnaongea spiritual peke yake. The body, the soul, and the spirit, they go together. Haziko separate. Si maombi tu kila siku. Hapa tumekaa masaa mangapi? Yeah, more than 2 hours. Tumeomba only 10 minutes. But we are still in the spirit because we were created by God. The physical, the social, the economic, everything roams around God. So hizi story pigeni. When you go to the gynecologist, usiende kama umefreeze, because examination, if your gynecologist tukuje tu tuongee, unaniambia una bleed, uko na discharge, then story inaishia hapo. Let me give you an example, a practical example. You come pregnant, you're 8 months, ukae hapo nikae hapa. Mtoto ako sawa, anacheza, nikuandikie supplements. How do you feel? Utasema daktari hajasikiza mtoto, you know the way those who have been pregnant and delivered before. Ukishikwa skize akwambie mtoto ako sawa, you'll feel good. Same with any other time you come to a gynecologist. There's what we call a pelvic examination. You need to know how your vulva looks like, how your vagina looks like. Si tunasema breast exam, self breast exam. You know about self breast exam? Pia kuna self exam ya huku chini. Put a mirror. Chungulia. Si huko ndani. Out here. Are the lips the same size? What is the color? So with time, any small change, ukiona naona naambiwa time, lakini sasa ndio imekuwa exciting sasa. Sawa, I think we close it. There's a question we didn't answer. Pap smear is every 2 years. Someone did ask how frequent. Every 2 years. So it coincides with your every 2-year gynecological visit. Thank you so much. I hope we didn't scare you. We welcome you to our facility or any other gynecologist that you feel free to attend to you. You can visit us in all the social medias. We are on Instagram, TikTok, YouTube. Many of the questions are endometriosis, fibroids. You'll find 30 minutes videos. Just Google Modern Gyno Clinic, Modern Gyno Clinic in all the social media pages. Thank you so much. God bless you.
So tumemaliza session yetu. I'd like us to take a few seconds to have a word of prayer. Thank God for this moment that we've had. Thank God for our doctors. Thank God for the people who have taken the videos. Make sure they edit the right things. Thank God, make sure the sound is there. Sawa. Make sure if video ikiuploadiwa kule social media, it has favor, ifikie watu wengine. Sawa, just 5 seconds, we say a word of prayer.